Thank you for joining us on this recorded webinar, Considerations for Victims with Cognitive and Communication Disabilities. The trauma caused by sexual violence can often make it difficult for survivors to express their thoughts, feelings, and needs. When a survivor of sexual violence has a communication disability, whether it was a pre-existing condition or was caused by the trauma itself, accessing support can be even more challenging. People with communication disabilities generally have their own unique ways of relaying messages to others, a different language of sorts. But oftentimes there is a disconnect between their manner of communication and that of the people who can provide them support. This can leave victims feeling frustrated or hopeless, in addition to the feelings of fear and shame that sexual violence often brings. You can play a vital role in supporting all survivors, especially those with communication disabilities, by learning to adapt more easily to different styles of communication. This recorded webinar will help you identify some of the ways in which people with communication disabilities may relay messages to you, both verbally and non-verbally, and will highlight some techniques and technologies that can help bridge the language gap. To help us with this topic is Dr. Scott Modell. Scott, I'll allow you to introduce yourself and take it from here.
Great, thank you. My name is Scott Modell. I'm currently serving as the Deputy Commissioner for the Department of Children's Services for the state of Tennessee. Previous to this position, I served as Deputy Commissioner for the Department of Intellectual and Developmental Disabilities in the state of Tennessee. And prior to that, I was a university professor in California for about 15 years, and I also directed our university's Autism Center for Excellence. So it's using those lenses that I'm going to share with you some information regarding consideration for victims with cognitive and communication disabilities. You know, I think it's helpful to give a scope of the problem that exists out there for folks with disabilities. And if we look at some of the data and some of the national data that we have, the average victimization rates in 2011 for people with disabilities is more than double the rate for people without disabilities. Serious violent victimization was more than triple the rate, and for females with disabilities, the rate was double. I'm sorry, for males with disabilities, the rate was double, and for females with disabilities, the rate was triple the victimization. So think about that. Double the victimization rate for males, triple the victimization rate for females with disabilities compared to their counterparts without disabilities. We know that individuals with disabilities are uniquely susceptible to sexual assault. There's some data that suggests sexual victimization rates are anywhere up to 10 times as high. And we also know from research, and I can tell you anecdotally from my clinical experience, is that offenders specifically seek victims with disabilities, especially those who have poor communication. So we have research and we have practice that tells us that folks who don't speak or don't speak well are good victims. They're perceived as good victims by perpetrators. If you can't report a crime, it makes you a much more viable victim to some of the offenders that are out there. So if we look at communication and what does that mean when somebody has difficulty communicating, I think it's helpful to observe communication in the context of what is our overall verbal skills as humans. And another way of thinking of that is one's verbal repertoire. So there's 4 basic types of communication in one's verbal repertoire. We have expressive vocal verbal, and that's commonly referred to as speaking, what I'm doing right now. And if you're understanding what I'm saying, you would demonstrate receptive vocal verbal behavior. It's understanding what's being said to you vocally. For example, if I was to say, could you pass me your pen on the table, and you picked up your pen and handed it to me, it's possible that we would say that you have receptive vocal verbal behavior because you responded to my expressive vocal verbal command. Now, I say it's possible that you have receptive vocal verbal because if I asked you for your pen while I was looking at it and pointing at it, we may not be able to distinguish whether you understood the words or you were responding to my expressive non-vocal verbal behavior. So what's expressive non-vocal verbal behavior? Well, it's still called verbal behavior because you're communicating, but we do this through gestures, facial expressions, body postures. In fact, we communicate a whole lot using non-vocal verbal behavior. So if I was to point at the pen at the desk and sort of nod my head and smile, and you picked it up and handed it to me, at the very least we would know that you had receptive non-vocal verbal behavior. That, in other words, you understood my expressive non-vocal verbal gesture or facial expression or body language, in this case pointing at the pen. So the example I gave earlier, if I ask for the pen while I'm pointing at it and looking at it and you hand it to me, I don't know whether you were just responding to me pointing the pen or you were responding to me asking you to see your pen, or both. So if I really wanted to distinguish whether you had receptive vocal verbal behavior, I'd have to ask you for the pen without looking at it or pointing at it. And you should practice doing that with somebody, because it's actually really hard to do if you're asking for somebody for something that's sort of in front of you. It's really hard not to look and or point at it. But if you really want to distinguish if somebody understands what you're saying, you need to do it in just in an expressive vocal verbal way and not use nonverbal behavior. Then you'll know that they understood what you were asking. Oftentimes, we'll hear folks use the term, oh, he's nonverbal or she's nonverbal. And what we typically mean when we say that in sort of the general language is that the person doesn't speak. Well, to be truly nonverbal, you would not have to have any of these 4 types of communication. In other words, you wouldn't be able to speak, you wouldn't make any gestures or facial expressions, or at least those facial expressions and gestures would be what we call non-contingent. In other words, if I ask you a question and let's say you grimace, and then I ask you another question and you smile, then I ask you another question and you smile again, and let's say I ask you another question and you grimace, based on the question I'm asking, we might suggest that you are what's called contingently responding. So that's possible that you, in that case, would have receptive vocal verbal behavior. Even though you weren't able to speak, you're understanding what I'm saying, potentially. But somebody who's truly nonverbal doesn't respond to gestures, doesn't respond to physical prompting, and you really don't know what their receptive ability is. And a couple things with this. One is, I have worked with probably thousands of children and adults with disabilities, and I've only come across this a handful of times. So very few people in the disability community are truly nonverbal, meaning they have no verbal repertoire whatsoever. So it's important not to assume that just because somebody speaks that they don't have any verbal repertoire. And this always makes me think of the book, The Diving Bell and the Butterfly by Jean-Dominique Bauby. And I tell this story a lot when I'm presenting to groups. And Jean-Dominique Bauby wrote this book. He lived in France. He was French, and I think he was very wealthy. And I may be getting some of the story off a little bit, but the gist of it's the same. It is the same. So he's heading to his to pick up his kids. I think he has a driver, and he's feeling really faint. And next thing he knows, he wakes up. He's in a hospital, and he can't move. He has what's called locked-in syndrome. And locked-in syndrome is you can't move any parts of your body, but you have full thought. So he describes himself as being weighed down by a diving bell, but his brain is like a butterfly. He can go anywhere. And, you know, he can see, but people are coming in the room and treating him like he's, you know, in a somewhat of a vegetative state. And a nurse realizes at some point in that he's blinking contingently. So what she does is she sets up this French alphabet. 1 blink is the most common letter in the French alphabet. 2 blinks is the next most common letter. And he blinked this whole book letter by letter. Very, very powerful. So it's important that we try to understand one's full repertoire of communication before we write somebody off as saying they're nonverbal. And oftentimes we'll also use the word function, like he's low functioning or high functioning. And that word's really, really problematic because it's not very descriptive at all. In fact, by labeling somebody high or low functioning doesn't really tell you anything. It's like when we say, like a child with an intellectual disability or an adult, let's say an adult with an intellectual disability, and we say, oh, they're functioning at a 5-year-old level. What really does that mean? It's not descriptive at all. In fact, it's somewhat made up. Because I know some 5-year-olds that I would trust to hold power tools, and I know other 5-year-olds that I wouldn't trust to hold a piece of paper. So functioning like a 5-year-old is somewhat of a nebulous term. It's really better to use more descriptors, like level of independence, support needs, one's skill sets. Really describe what they're able to do as opposed to saying high or low functioning. And here's the thing. Someone who we say, for example, if those of you who work with investigators or supervisors, someone who writes a report and says, you know, the house was filthy. They come back and in the report it says the house was filthy. Good supervisors and good investigators would get frustrated because what's filthy? You can't observe filthy. Filthy means different things to different people. You would want them to write in the report, oh, the sink was filled with dishes. You know, there was garbage on the floor. There were ashtrays filled with cigarettes. That's much more descriptive. Same thing here. When we label somebody as low functioning, it really doesn't tell us much. It's such a broad term. So much better to use descriptors like, are they independent? Do they, you know, what are their support needs? And describe their skill sets specifically. Another thing to consider is we have this bias here in the U.S. and the work I've done in other countries, it exists there too. We have this bias that if you speak well, we think you're intelligent. And if you don't speak well, we think that you have an intellectual disability. In fact, we also do it by the way somebody looks. If we see somebody who's drooling, maybe they have cerebral palsy and they have some craniofacial anomalies and they can't hold saliva in their mouth, we assume somebody's drooling, they're not speaking, they're moaning, they must have an intellectual disability. And we really need to sort of pledge not to do that. In fact, it would be best if we assumed normal intelligence until you had multiple data points to tell you something different. And it reminds me of the story of this young man, Bert, that I worked with. And he came to a program I was working, and he was 19. They said he was in a car accident when he was 15, and everybody in the car died but him. It was one of those types of accidents. And I remember my first thought of Bert when I saw him, and he had a patch over one eye and he had a blank stare in the other eye and was drooling a little bit. And I was working on my degree in special education, my graduate degree, and I remember thinking, God, what am I going to do with this kid? And I don't think the word vegetable came to mind, but it was something like that, like, God, what am I going to do with this kid? And after a while, he starts communicating with me. He has a communication device, and he also starts speaking. And I realized, God, I really made some assumptions about this kid, and well, I wonder how he can do in our program. And he wasn't there for the program. He was there to help. He actually was a university student, and I made all these assumptions about him just by the way he looked. And you know, you figure if you're getting your degree in special ed, you really shouldn't be making these assumptions. So we all do it. So I ask you, those of you who are listening to this, to sort of pledge to yourself that you won't make assumptions on somebody's intelligence just based on the way they look or just based on the way they speak or if their speech is impaired. You really need multiple data points to determine whether somebody has an intellectual disability or not. And with that comes using what we call person-first terminology. You really want to refer to people with disabilities as people with disabilities, not disabled people or handicapped people. Just use the word person. If you don't know what to call somebody, and let's say somebody named Michael has some disability and you're not sure how to refer to him, just call him Michael. So use the word person or use their name. It's better than saying the disabled person or the autistic child. I always give the example, if you have a relative that has cancer, you wouldn't say this is Aunt Betsy, she's cancerous. You would say she has cancer. Similarly, we should say people have autism or have a disability and instead of saying they're autistic or disabled. So let's talk a little bit about communication disorders. Excuse me. What do you do with someone who you're talking to and you can't understand a word they're saying? In other words, you ask them a question and all you hear is ah, ba, 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 or da, da, or grunts or no sound at all. And one of the things we say is that the first thing to do is try to establish a yes-no communication system. In other words, try to see if they will contingently respond to yes/no questions. Simple, easy yes/no questions. And they could respond through eye blinking, they could respond through head nodding, other symbols, hand symbols or gestures. And that's the key, is to see if they at least can respond yes or no. Sometimes we've done things with folks where you hold out your hand. You would say, okay, Michael, are you hungry? And you hold out your right hand and you say yes, and you hold out your left hand and you say no. And some folks will touch one of your hands as an example for yes, no. And one of the things that is important to do, and in research this is called lie scale validity, one of the things that's important to do is to determine if that they're answering yes, no appropriately, and you want to validate it. So on the slides here we have a picture of a tree, an ice cream cone, and a dog. And I might say to, and we'll keep using the case study example here, Michael, okay, Michael, I just want to make sure that I understand that how you're saying yes and how you're saying no. I'm going to ask you some questions. And I might show the picture of the tree and say, okay, Michael, this is a picture of a motorcycle. And of course, we would expect a no response, either a vocal verbal response or a non-vocal verbal response. Then I might show the ice cream cone and say, this is a picture of a ice cream cone. And you would hope that you would get a yes response. Same thing with the dog. You might say, this is a picture of a dog, and you'd hope to get a yes response. Or you might show the picture of a dog and say, this is a picture of a house. And is that correct? And you'd hope to get a no response. So however you do it, you want to validate with very easy questions to ensure that you know how they're saying yes correctly and you know how they're saying no correctly, and that they're what we call contingently responding. In other words, responding based on the questions you're asking, not responding to them as it relates to just assuming that when they say yes, it's accurate, and assuming when they say no, it's accurate. What you also can do if somebody has difficulty communicating, you can ask them to write their response or draw it or show you. And an example I typically give is an example with my brother. My oldest brother has an intellectual disability, and sometimes I have difficulty understanding what he wants. And one year I asked him, is there something what do you want for Christmas? And he said, Ossipa. And I said, Ossipa? I'm not sure, what Ossipa means. And my brother doesn't write, he doesn't draw. I never thought to say show me, and that might have helped. So I did the next best thing, and I asked my mother, because she understood him a little bit better, and I asked her, do you know what Chris is asking for? And she didn't understand either, and it was a little bit frustrating. And then I'd say a few months went by, and we were walking by a record store, and of course by the term record store you could tell this story was a little while ago. I said, my brother Chris points and he says, Ossipa, and what it was an album of Air Supply. So I said, oh, Air Supply, that's what Ossipa is. So I got him the record, and of course now I like Air Supply. So the other thing is some folks use other types of alternative communication in pictures, and we call different types of alternative communication sometimes alternative or augmentative and alternative communication. And augmentative and alternative communication consist of could be manual signs, could be gestures. Of course, American Sign Language is its own communication system, but eye gazing, pantomime, all those things would fall under there. So as you see on the slide, the technical definition is any process or device that helps or augments or replaces an individual's method of communication. And some examples would be like a PECS. PECS stands for Picture Exchange Communication System. It's very commonly used with children with autism. And these are little icons that they use. Typically they're laminated and have Velcro, and they could put things on their icons to try to communicate different things. On the next slide here, we have more of a dynamic device. So years ago, we used to have devices to help people communicate called the Dynavox. The Dynavoxes were these big devices, anywhere between $3,000 and $7,000, and it was sort of a modern-day iPad for folks. And One of the things about Dynavox is not a lot of folks use them because they're big, they're somewhat clunky, but iPads with some of the apps that they have today, and this is just a sample app called ProLoQ to go, where they're somewhat dynamic, where you can really communicate quite a bit using one of these dynamic devices, and they're much less expensive than the Dynavoxes, and they're not seen as, for our younger generation who use them, not seen as sort of some therapeutic device, but somewhat cool because everybody uses them. We also have both handheld and sort of computer-based, or I would say desktop-based text-to-speech keyboards. And when you're communicating with somebody with one of these who uses augmentative alternative communication, like a communication device or a text-to-speech keyboard, don't assume they have intellectual disabilities. And again, if we go back to the pledge, we would want to pledge that we're not going to make assumptions about one's overall ability, intellectual ability, just based on the way they speak or don't speak or the way they look. Augmentative and alternative communication may be one of several ways which a person communicates. I worked with this young man, Brian, who would give you thumbs up and thumbs down for yes and no. He also had a text-to-speech handheld device, and he spoke. It was very effortful for him, and it had to be really quiet, but he did speak a little bit. So he would speak, he would use gestures, and he would use a communication device. You typically don't need any special training to communicate to somebody who's using a device. You want to make sure you speak directly to them. And this goes with especially somebody who's using sign language and a sign language interpreter. It's somewhat natural to want to look at the interpreter when you're talking because they're the one who's talking back to you, but you want to speak and look directly at the person you're communicating with. So if a person who's deaf is using a sign language interpreter, you want to look at the person who's deaf. They'll be looking back and forth between you and the interpreter, but you want to pay attention to the person who you're speaking with, not the assistive device. If possible, try not to interrupt them when they're using the device. And really, when you're communicating with folks, especially those who use augmentative and alternative communication, be comfortable with silence. So those are just a few things to think about in terms of communicating with folks with cognitive disabilities, people with difficulty communicating especially. Try not to make assumptions about their overall ability. When describing their overall quote-unquote functional level, be very descriptive about their skill sets, their independence, their support needs, as opposed to just saying high or low functioning. And increase your experiences where you can communicating with folks with different communication styles, and the easier it gets. Thank you.
Great. I just have a couple of questions for you, Scott, just to kind of add on some of the things I was thinking about.
Please, go ahead.
Well, first of all, a lot of our advocates and victims in the anti-sexual violence movement might have their first contact with people over the phone. So let's say someone might call into the hotline or call into the center to see about getting services. What advice might you have if someone calls into one of those, the hotline or something, and maybe is difficult to understand? What specific steps might the volunteers or advocates be able to take to better communicate with the people over the phone?
Great. I think that's a very good question. One of the things when somebody has difficulty speaking, and this would be, you could do this in person, but it works over the phone, is try to repeat and paraphrase what they say to ensure that you have it. And don't be afraid to say, I'm sorry, I didn't understand you. So that's one. Don't be afraid to say, I'm sorry, I didn't understand you. Could you repeat it? Don't be afraid to repeat and paraphrase or paraphrase what they say to make sure you get it. Wait for them to confirm. And then if you have questions for them, try to ask, if possible, questions that require short responses. It will be less effortful for somebody who has difficulty communicating to respond.
Great. That's really helpful information. Very usable. And then finally, you're talking a little bit about different communication devices and assistive technologies. You may only be able to speak from a Tennessee perspective, but maybe not. What are some ways that you would suggest that advocates and other victim service professionals maybe try to help people connect with these different types of services or technologies, maybe if they don't already have access to them?
Another great question, and I'll actually speak from a Sacramento, California perspective, where I spent
Okay.
15 plus years, or about 15 years, sorry. So I'm not sure if there still exists, but it's called SCAT, S-C-A-T, the Sacramento Center for Assistive Technology. And I actually think the other day here in Nashville that I passed by a sort of Nashville Center for Assistive Technology, or Tennessee Center. So my suggestion would be, in your local area, see if there's any centers for assistive technology that exist, and then if you're having difficulty finding those, try to connect up with any local universities and their special education departments, especially those folks who have degrees in communication disorders. They should know where those resources exist.
That's excellent. Thank you so much, Scott.
You're welcome.
All right. Just to wrap up, people with communication disabilities who've experienced sexual violence can definitely be supported, just like any other survivor, though as we've learned and talked about, there's going to take some patience and maybe a bit of creativity. Their trust in others may have been broken already has been broken already through sexual violence, and will need to be rebuilt, and an effective means of connection will need to be established with them in order to do that. You can show survivors with different ways of communicating that you believe them and that you want to offer support by putting in the time and the effort to help understand their thoughts, feelings, and needs. Every small step towards developing a shared understanding will make a really big difference in their healing process. Thank you again for joining us on this recorded webinar.